So in this segment, we'll be covering pathology of the appendix, and to start, we'll go over appendicitis. So appendicitis is most common in adolescents and young adults, however, it can occur at any age. Typically, it's due to luminal obstruction by a fecalith or which is a small stone-like mass of stool. It could also be caused less frequently by gallstones, tumors, or even parasites. The obstruction leads to increased intraluminal pressure, which in turn compromises venous outflow and leads to stasis. This results in ischemic injury and bacterial proliferation, which results in an inflammatory response. So you're going to get edema and a dense neutrophilic infiltration. Patients will often present with periumbilical pain that localizes to the right lower quadrant. So one sign you can have is the famous McBurney sign, which you all know, is tenderness over McBurney's point, which is located 2/3 the distance from the umbilicus to the right anterior superior iliac spine. Other signs you might have are the obturator sign, and for this you have the patient lie down on their back with the hip and knee flexed at 90 degrees, and then a positive test results when there's pain with internal rotation of the hip. There is also the psoas sign, where you get right lower quadrant pain with passive extension of the right hip or active flexion of the person's right hip while supine. And the final sign we're going to talk about is Ruffsing sign, and this is pain in the lower right quadrant with continuous palpation on the left side. Patients also often present with nausea, vomiting, fever, and a mildly elevated white blood cell count. Often, appendicitis can be confused with mesenteric lymphadenitis, acute salpingitis, ectopic pregnancy, middle smirch, or even Meckel's diverticulitis. So if it's not clinically apparent that this is appendicitis, often to diagnose you can get a CT. Complications include rupture and suppurative peritonitis. In terms of the morphology, grossly, as you can see in the top right-hand corner, your appendix is going to be dull, granular, and erythematous on the surface. On histology, as you can see in the two lower pictures, you're going to have neutrophilic infiltration of the muscula propria, and you need this in order to diagnose acute appendicitis. In more severe cases, you can actually get focal abscesses within the wall, and then this is called acute suppurative appendicitis, and this could even progress to large areas of hemorrhage and ulcerations, or even gangrenous necrosis that extend to the serosa, and this would result in acute gangrenous appendicitis, and after this, you can get rupture and the suppurative peritonitis complications we mentioned. So now we'll go ahead and talk about different tumors that you can find in the appendix. Your most common tumor is carcinoid. Typically, you actually find this incidentally during appendectomy for appendicitis. The tumor is typically located in the distal tip, and this is a neuroendocrine tumor. So you're going to see these small, round blue cells, and they have a salt and pepper speckling pattern of the nucleus. Other tumors that you can find in the appendix include adenomas and other non-mucin-producing adenocarcinomas. These can result in obstruction of the appendix and enlargement, in turn mimicking appendicitis clinically. You could also get a mucocele, which is just a dilated appendix filled with mucin. This could just be from an obstruction with insipid mucin, or you could actually be from a more serious mucinous cyst adenocarcinoma. If you get invasion of the mucinous cyst adenocarcinoma through the wall, you can actually get intraperitoneal seeding and spread. And in this case, these peritoneal implants could actually be mistaken for mucinous ovarian tumors. And then in the most advanced case, the whole abdomen can fill with mucin, and this is termed pseudomyxoma peritoni. And In most instances, this is ultimately fatal.